The state and the Command Council, etc., have been far more diligent in asserting the positive aspects of the trajectory. So, for example, the yesterday released stats showing that the infection rate amongst health workers is only 5%, half the global average. Amongst health workers in South Africa, the fatality rate has been 0.9%, very low. And this echoes stats that have been released before. The fatality rate, according to the state, amongst the general population is similarly half the global average. And the general tenor of the commentary by the government and by the state is that South Africa has a capable state that was rising to meet a dire challenge, one capable of ensuring a rigorous lockdown while it increases capacity to meet a medical emergency. Unfortunately, reality seems to be a bit different. COVID saga has, if anything, highlighted the poverty of information shared by the National Institute of Communicable Diseases, the various departments of health, Statistics South Africa, and even education institutions. And I'll explain what I mean by that. First thing we do, we just examine the infection rate. So what this graph does, it shows that the dotted blue line is what an exponential growth of the infection rate would be. You can see that we have recently, the actual infection rate is given by the black line. And the two lines are diverging quite dramatically at the moment. So if we simply model the infection rate on the basis of the experience of places like Hubei and the like, we would have a graphic like this, where a dotted blue line would show the initial exponential growth, the tailing off, and then the flattening of the curve. Overlaid on this blue line is that thicker black line, which is the actual growth. And you can see that the actual growth of the epidemic almost perfectly matches that model. So essentially what this means is that the pandemic has been keeping to the script. It has been doing exactly as should have been anticipated.